Hi, it's Jordan, the Compassionate Behaviorist. I'm talking to you today about what is DBT. DBT stands for Dialectical Behavior Therapy. It was founded by or developed by Marsha Linehan. She published a book in 1991 called Cognitive Behavioral Therapy for the Treatment of Borderline Personality Disorder. DBT is a form of treatment that was initially designed to help people who were struggling with chronic suicide urges and ideation. It further was developed for people with borderline personality disorder, people who had been diagnosed with that specific disorder. And since that time, in the last almost 30 years, it's been researched and found to be helpful for people with a wide variety of struggles, including substance abuse, eating disorders, depression, and other struggles that include emotional dysregulation. Emotional dysregulation meaning the sense of either feeling not in control of our emotions, like we're feeling things too much and we're reacting too much to emotional experience, or the opposite of not feeling at all, feeling numb, feeling cut off from our emotions, and oftentimes going back and forth between the two. So, dialectical, or the D of DBT, that is a word that means holding opposites together. Sometimes the kind of simplistic formulation of dialectical can mean you have a thesis or you have one idea, then you have the antithesis or the opposing idea, and then you have a synthesis. Or at least you have the holding of the two opposites. That's what dialectical means. It goes back far into Eastern and Western philosophies. You can think of the yin and yang in Eastern philosophy and Eastern religion. You can think of Hegel in Western philosophy and his ideas about dialectics. In DBT, the primary dialectic is that of acceptance on one hand and change on the other. So rather than just focusing on the client changing, we are also focused on accepting the client as they are, accepting everything as it is, ourselves, the world, the moment. So along with behavioral change strategies, there's a lot of mindfulness and acceptance strategies, things that help us get in touch with being with reality as it is, being with the moment as it is. There's a lot of therapies that have introduced mindfulness and acceptance strategies into them and found a lot of effectiveness towards changing things when we start from a place of acceptance. So that's what dialectical means briefly, is holding opposites. Behavioral replies to principles of behavioral science. Principles of behaviorism are things that you may have heard of about reinforcement and punishment, and basically the things that either make us more likely or less likely to change some behavior. And principles of behavior are universal. They are like principles of gravity. They affect us whether or not we know that they are happening, or whether or not we understand them, they're still affecting us. So the idea with behavioral science is that we're all being affected by each other. We're all being influenced and influencing the world around us, and that we can understand how that's happening, and we can help our clients understand how that's happening, and we can kind of use those principles to affect ethical and compassionate change. So that's the B from DBT, is behavioral. And then the T, the therapy side of it, that's what the treatment is. And DBT consists of 4 different main kind of modes. And those 4 are: 1, individual therapy with a therapist who's been intensively trained in DBT. And that's where you're really aligning yourself and with the client and finding out what their goals are, helping them learn skills and problem solving, and helping enhance their motivation to build a life worth living. So individual therapy. Then skills group, that's where their clients are learning skills and enhancing their capabilities to regulate emotions, to be effective in relationships, to tolerate distress, and to build that kind of mindfulness. 3 would be phone coaching, and that's when a client is able to call their therapist in between sessions and reach out to them for assistance. And the importance of that is that the skills that the client is learning need to be generalized into their everyday different environment. And this is part of the behavioral method too, is that we're trying to reinforce skill use into different everyday life situations where adaptive behaviors or skillful behaviors have not been reinforced, and instead maladaptive behaviors, things like self-harm or substance use or other problematic behavioral patterns, have been reinforced. Oftentimes they work in the short term and not in the long term. They make things worse in the long term. So phone coaching is a major part of DBT therapy as well. And the fourth mode or kind of component of DBT is DBT consultation. And that is when the therapist joins a group of professionals that are doing DBT in the community, and the therapists are helping each other increase their motivation and skillfulness in treating clients. So those are the four kind of modes of DBT, dialectical behavior therapy. It's not the only kind of therapy. It's not the only kind of therapy that's effective, but it's a very powerful and kind of very specific way of working with clients that have really complex problems. And I found it to be tremendously helpful for clients, especially those who struggle with self-harm issues, those who have had multiple traumas, those who have struggled with dissociation and psychogenic non-epileptic seizures, otherwise known as pseudo-seizures. So this is a kind of therapy that I've been using quite a bit in the last 5 or 6 years, and have seen the power of applying it with people who are struggling with a lot of complex issues. And anyway, this is the part of the overview. Hope that this is helpful, and be good to each other out there and to yourselves, and we'll see you again. Thanks. Bye.